Hi everyone, and welcome to today's video. If you've ever experienced sudden, intense joint pain, especially in your big toe, you might be dealing with gout. Gout is a form of arthritis that has been around for centuries, famously known as the disease of kings due to its association with affluent diets and lifestyles. But gout isn't just a condition from history books. It's a modern health issue that affects millions of people worldwide. In this video, we'll explore what gout is, what causes it, how to recognize the symptoms, and most importantly, how to manage and prevent painful flare-ups. Before we get going, please subscribe to this channel and click the bell for more information about arthritis and the common types. So, whether you're newly diagnosed or just curious about this condition, stay tuned. Let's get started. What is gout? Gout is not a single disease but a term that includes over 100 different types of inflammatory joint disorders, with the most common ones being osteoarthritis and rheumatoid arthritis. Gout is a metabolic disorder caused by the accumulation of uric acid crystals in the joints. It is a well-known and highly painful and is known for being extremely painful, often striking suddenly, usually targeting the big toe, and is marked by symptoms such as intense pain, redness, and swelling, but it can develop in your fingers. Gout has been recognized since ancient times and was often referred to as the disease of kings due to its association with rich diets. Historical figures such as King Henry VIII and Benjamin Franklin suffered from gout, highlighting its prevalence among the wealthy. This historical context emphasizes the role of diet and lifestyle in the development of gout and adds a cultural dimension to its understanding. Gout is a type of inflammatory arthritis that results from hyperuricemia, elevated levels of uric acid in the blood. Uric acid is a byproduct of purine metabolism. Normally, it dissolves in the blood and is excreted through the kidneys. However, when uric acid production increases or excretion decreases, it can accumulate and form sharp, needle-like crystals in the joints and surrounding tissues, triggering inflammation and intense pain. There are several stages in the development of gout. 1. Hyperuricemia. This stage involves excess uric acid in the bloodstream. However, not everyone with hyperuricemia develops gout, as many people remain asymptomatic. 2. Crystal formation. When uric acid levels in the blood become too high, sodium urate crystals can form in the joints. 3. Inflammatory response. The immune system identifies these crystals as foreign bodies. White blood cells, especially neutrophils, attack the crystals, releasing inflammatory mediators. 4. Acute attack. This immune response leads to the classic symptoms of gout, a sudden and severe attack of joint pain, redness, warmth, and swelling. In this next section, I shall explain the clinical symptoms that gout can cause, which can include: acute joint pain can often start in the big toe, but it may affect other joints such as ankles, knees, elbows, wrists, and fingers. Gout could also start at night, waking you up with intense joint pain. Symptoms could include swollen, tender, and red. Other symptoms affect the area around the joint, such as feeling warm to the touch, and it becomes lumpy with urate crystals that develop under the skin around the joints and other tissues. Warm to the touch, and with the pain and swelling, it can lead to a decreased range of movement around the affected area, making simple tasks difficult. The lumps of urate crystals are known as tophi, which can develop under the skin around joints and other tissues. Risk factors. Several risk factors increase the development of gout. They include: genetics. If you have a family history of gout, you could be at a higher risk of developing gout. Diet. High intake of purine-rich foods, such as red meat and seafood, sugary beverages, and alcohol, especially beer, can raise uric acid levels. Listen to the end of my video, and I shall show you which foods you could eat and which to avoid. Obesity. Excess body weight increases the production of uric acid. Medical conditions. If you have a medical condition like hypertension, diabetes, metabolic syndrome, or chronic kidney disease, it can all contribute to too much uric acid in the body. Medications. You should avoid diuretics, or water pills, low-dose aspirin, and immunosuppressive drugs as they can increase uric acid levels. Diagnosing. Diagnosing gout involves a combination of clinical evaluation, lab tests, and imaging studies. 1. Clinical history. Sudden onset of joint pain, swelling, and redness. 2. Physical examination. Identifying the affected joints and assessing the symptoms. 3. Laboratory tests. Measuring serum uric acid levels, though this may not be reliable during acute attacks. Joint fluid analysis to detect uric crystals is the most definitive test. Also, blood tests will measure uric acid levels in the blood. 4. Imaging tests. X-rays, ultrasound, or dual-energy CT scans can detect uric crystals and assess joint damage. Your doctor may also use a needle to withdraw fluid from the affected joint, which can show whether there are uric crystals present. Managing gout includes both acute treatment of flare-ups and long-term strategies to prevent recurrence. This involves lifestyle modifications that are essential in managing gout, including medications and dietary changes to reduce purine intake. They include as limiting alcohol consumption, maintaining a healthy weight and staying well hydrated. Before we dive into the treatment of acute gout, please click the subscribe icon and click the bell. This way, you'll stay updated on more videos about arthritis and related topics. Acute treatment. Acute gout treatment involves medications that reduce pain and inflammation. Nonsteroidal anti-inflammatory drugs are commonly used and effective when taken early in an attack. Colchicine is an alternative to nonsteroidal anti-inflammatory drugs and is especially helpful if started promptly. Corticosteroids may be used when nonsteroidal anti-inflammatory drugs and colchicines are ineffective or not suitable for the patient, also to lower the uric acid levels. Long-term management focuses on preventing future attacks and maintaining healthy uric acid levels. This includes urate-lowering therapy. Medications like allopurinol and febuxostat reduce uric acid production, while probenecid helps the kidneys excrete more uric acid. Lifestyle modifications, dietary changes, maintaining a healthy weight, and reducing alcohol intake can significantly lower uric acid levels. Regular monitoring, routine checkups and blood tests are essential to track uric acid levels and adjust treatment as needed, and overall health is crucial. Do not forget to press the subscribe button and ring that bell. In this next section, I shall explore how gout differs from other types of arthritis. Although gout is classified as a form of arthritis, it differs in several key ways. Cause: gout is caused by metabolic issues that lead to uric acid crystal buildup in the joints. In contrast, osteoarthritis, OA, results from wear and tear, while rheumatoid arthritis, RA, is an autoimmune condition. Onset: gout often starts with sudden, severe pain, typically in the big toe. Whereas other forms may have a more gradual onset and different joint involvement, the treatment is the same as other arthritis. Treatment: while gout shares some treatment approaches with other forms of arthritis, it uniquely includes colchicines and urate-lowering therapies. The last section is about how gout can have a significant impact on both your personal and professional life. You should keep to your doctor visits, medications, and hospital stays. This can have an effect on your life. Severe attacks can increase healthcare costs. Acute attacks can lead to missed work days and decreased productivity. Also, your chronic pain and fear of recurrent attacks can significantly affect your quality of life. Chronic pain and anxiety about future attacks can affect your overall quality of life. The conclusion is that gout is a type of inflammatory arthritis caused by the accumulation of uric acid crystals in the joints. It falls under the umbrella of rheumatoid-type arthritis but has distinct causes, symptoms, and treatment strategies. You can reduce the risk and frequency of gout attacks by eating a healthier diet, for example, choosing chicken or turkey over red meat, staying active, and maintaining a healthy body weight, as obesity increases the risk of repeated attacks. Thanks to ongoing research and advancements in treatment, The future looks promising for better management and improved quality of life for those living with gout. Thanks for watching my video. Please note that I am not a medical professional. The information in this video is for informational purposes only. If you have concerns about your health, please consult your healthcare provider. If you found this video helpful, please click the subscribe button to follow my channel and press the bell icon for notifications. If you have any questions, feel free to leave a comment below, and I'll get back to you. I hope this video has helped you, and good luck. Don't forget to click on my next video to help you discover which foods can help relieve painful, inflamed joints, and which ones you should avoid. See you in my next video.